Hello, this is Group 1's presentation. We are looking at Ida Jean Orlando and her nursing process theory. Our group members are Tracy, Nurjaveen, Rashbir, and Fritz. We are presenting the following context.
Ida Jean Orlando was born on August 12, 1926 and died on November 28, 2017. In 1947, she received a diploma in New York Medical College, Flower Fifth Avenue Hospital School of Nursing. And in 1961, she received bachelor's degree in public health nursing at St. John's University in Orlando. Moreover, in 1954, she received a master's degree in psychiatric nursing in New York. In addition, he is a head and assistant professor, Department of Mental Health and Psychiatric Nursing in Yale. In 1961, she published the research The Dynamic Nurse-Patient Relationship, and in 1972 published her studies The Discipline and Teaching of Nursing Process. And lastly, in 1972 and 1981, she conducted seminars in the US and Canada about her theories. According to the theory, all patient behavior can be cry for help, both verbal and nonverbal, and it is up to the nurse to interpret the behavior and determine the needs of the patient. The goal of this model is for a nurse to act deliberately rather than automatically. And lastly, Orlando's nursing theory stresses the reciprocal relationship between patient and nurse. What the nurse and the patient say and know do affect them both. 5 major concepts of the theory is number 1, professional nursing function. The patient is the focal point of nursing. The second one is patients presenting behavior. Patients' interaction showing verbal and nonverbal behavior, a need for help. And third is immediate reaction. It is about the nurse perception, thought, and feelings. And in this process, the 5 stages: assessment, diagnosis, planning, implementation, and evaluation. In the assessment, it involves holistic assessment of patients' needs, diagnosis, nurse clinical judgment about health problems, and in the planning, address each problem in the diagnosis, and in the implementation, using the nursing care plan, and in evaluation, checking the progress towards the goal in nursing care plan. And the fourth major concept theory, deliberative nursing process. Nurse must focus on the patient rather than the assumption of and the nature of the patient's problem. And lastly, improvement. When the patient's immediate needs for help have been determined and met, here is improvement.
I will go over the main fundamentals of Ida Jean Orlando's nursing process theory. There are several assumptions in Ida Jean theory that supports nurses' role. These are: when patients cannot cope with their needs on their own, they become distressed by feeling of helplessness. In its professional character, nursing adds to the distress of the patients. Patients are unique and individual how they respond. Nursing offers mothering and nursing analogs to an adult who mothers and nurtures a child. The practice of nursing deals with people, the environment, and the health. Patients need help communicating their needs. They are uncomfortable and ambivalent about their dependency needs. People can be secretive or explicit about their needs, perceptions, thoughts, and feelings. The nurse-patient situation is dynamic. Actions and reactions are influenced by both the nurse and the patient. People attach meaning to situations and actions that are apparent to others. Patients enter nursing care through medicine. The patient cannot state the nature and the meaning of his or her distress without the nurse's help, or him or her first established a helpful relationship with the patient. Any observation shared and observed with the patient is immediately helpful in ascertaining and meeting his or her need or finding out that he or she is not needed at that time. And the last, nurses are concerned with the needs to patient if unable to meet on his or her own.
How does this theory or philosophy relate to the 21st century nursing practice? In Ida Jean Orlando's nursing theory, she stresses the reciprocal relationship between the patient and the nurse. It emphasizes the critical importance of patients' participation in the nursing process. Orlando also considered nursing as a distinct profession. Health in the theory focuses in the continuation of the involvement around meeting patients' needs. She believed that if the patient's needs have been met, this can modify the patient's health status, therefore creating a productive environment. In our case study, we have Mrs. Jones. Mrs. Jones is 53 years old. She was admitted to long-term care facility with a history of early dementia, defined as early onset dementia, with Lewy body dementia as well. She's accompanied by her husband, David, who is barely coping with emotions. The cardiacs and background information indicate Mrs. Jones has hypertension of 150/95, hypoglycemia, increased confusion. She had difficulty finding the right words. Gait disturbances were noted, agitation, and restlessness. The physician examined her and ordered Rampapril 2.5 milligrams every day due to her hypertension. And cholinesterase inhibitors, Dopavil, 5 milligrams at bedtime to help relieve some of the symptoms of young onset dementia. The husband, David, was encouraged to think of distractions to ease the process, as Mrs. Jones may get upset when he leaves. During this incident, it's supper time, and the nurse has entered the dining hall to be immediately approached by another resident pointing to Mrs. Jones. She's pacing back and forth. She's all sweaty and very confused. She's looking for her husband, but he left a while ago. Upon approach, the nurse does immediately notice Mrs. Jones is out of her seat indeed. She appears flushed, pacing in a circle with restlessness, trying to get to the kitchen staff's attention to help bring her a drink and food. The nurse is aware of Mrs. Jones's dementia, hypertension, and diabetes diagnosis. The nurse approaches Mrs. Jones to assess what could be causing her to be having this current outburst. The nurse also asked the PSW to see if Mr. Jones, her husband, is still in the building, as he is a great support system to Mrs. Jones and her mental well-being. In the dining room, Mrs. Jones is having trouble following conversations. She's wandering back and forth, looking for her husband. Other patients in the dining room are getting agitated by her behavior.
Steps in the nursing process: client assessment, client goals, and client evaluations. Client assessment. According to the Orlando, in the records judged as good, the nurse focus was on the patient's immediate verbal and non-verbal behavior from the beginning through the end of the contact. Whereas in those judged bad, the nurse's focus was on prescribed activity or something that had nothing to do with the patient's behavior. When good nursing occurred, the nurse listened to what was happening and identified the patient's distress. The nurse understood why the patient was distressed and recognized that without the nurse's help, the patient distress was not relieved. Orlando conclude that the function of professional nursing is to find out and meet the patient's immediate needs for help. Good nurses focus on the immediate verbal and non-verbal behavior of patient from the beginning through the end of the contact. Focus on deliberative interpretation of the patient, whereas bad nurse focus on something that had nothing to do with the patient's behavior. Automatic nursing formulation. In the assessment stages, the nurse complete a holistic assessment of the patient's needs. This is done without taking the reason for the encounter into consideration. The nurse uses a nursing framework to collect both subjective and objective data about the patients while interviewing Mrs. Johnson and her husband David. Subjective data: hypertension, hypoglycemia, impaired gait, depression due to away from family, which is assessed by the Beck Depression Inventory, the Zeratic Depression Scale, or the Hamilton Rating Scale for depression. Objective data: memory loss, confusion, restlessness, agitated, sweaty. Client goals: drugs may lessen the symptoms of dementia, but they cannot cure it. They might enhance behaviors, mood, or mental health. There are subjective that can help with it. Hospice palliative care: advice on how to assist the person live independently for as long as possible. Medicine: while there is no known cure for dementia, medications may aid with mental capacity, mood, or behavior. Assistance and counseling: anger, worry, and anxiety are all common reactions to learning that you have dementia. A person with dementia who is in the early stages of the condition should seek emotional support from family, friends, and possibly a counselor with dementia experience. Planning for the future: planning for future is very important to deal with dementia, so involve Jones and her husband in it. Ask the questions like, what kind of care are they currently in need of? Who will look after them going forward? What might the family anticipate as the illness worsens? What sort of monetary and legal planning is necessary? Find the records you need to evaluate the person's financial and legal situation. These consist of deeds, mortgages, bank accounts, pension informations, prior tax returns, wills, and trusts, private health and life insurance policies, prior tax returns, and information on other financial investments. Examine who owns the person's belongings. Discuss the implications of transferring assets with your attorney. Educate the client and their family about home care. Treatment as dementia get worse. The purpose of continuous dementia care is to keep the patients as safe as possible at home while also offering support and advice to the care. Regular follow-up appointments with a medical expert and review every 3 to 6 months to keep track of the patient's medications and level of functioning. The family may eventually needs to decide whether to put the patients in a care facility with a dementia unit.
Mrs. Jones at this time is redirected by the nurse to the nursing station. Mrs. Jones appears to be calmed down now that her husband has showed up. In the client evaluation, Mrs. Jones is assessed and evaluated. She can be having a hyperglycemic episode. The nurse gets husband to hold Mrs. Jones' hand and guide her to the nursing station. Less attention from the other residents may help ease Mrs. Jones' irritability and agitation. The nurse explains to Mrs. Jones that she has to check her blood sugar levels and we will need to prick her finger for 1 second. Mrs. Jones states she is very tired, thirsty, and needs to use the bathroom. All symptoms the nurse uses to help confirm she is experiencing high blood sugar episode. The nurse tells Mrs. Jones that we will take that all taken care of once we get her blood sugars assessed and taken care of. Mrs. Jones cooperates and the blood sugar is elevated at 16.2. The nurse checks Mrs. Jones' chart and seeing a standing PRN order for fast-acting insulin, Nova Rapid, and uses the sliding scale to administer the insulin. The nurse assures that she is talking to her throughout the process to keep the patient calm. Fast-acting insulin usually takes effect within 4 minutes. Mrs. Jones is offered water at this time, and the nurse begins to see Mrs. Jones' respiratory rate normalizing. Her cheeks are not as rosy. The nurse assesses Mrs. Jones's gait and seems to be more steady and helps her to the restroom. As she walks Mrs. Jones back to the nursing station and redoes her blood sugar, the results come back at 12.2. Mrs. Jones is noted to be returning to her normal status and is evaluated that she can go have her lunch. Mr. Jones walks Mrs. Jones to the dining room to have her lunch. The nurse places a call into the doctor to have a patient do a proper blood work completed, including the HB1IC glycosylated hemoglobin to assess a full diabetes mellitus diagnosis. When evaluating a patient for hypoglycemia, the focus should be on the patient's cardiovascular status, mental status, and volume status. Glycemic control in patients in the type 1 diabetes is achieved by a variable insulin regimen along with proper nutrition. Acute occurrences of hypoglycemia may require emergency treatment in the form of fluid and electrolyte replacement or insulin therapy. Long-term, your healthcare professional may recommend a combination of the following. Regular exercise as a way to control blood sugar. Medication is prescribed by the healthcare professional. A healthy diet that reduces the amount of sugary drinks, foods that encourages the consumption of whole foods. Regular blood sugar monitoring to ensure that you're in the optimal range. Insulin regulation to supplement and or adjust your insulin levels, helping to temporarily correct the high level of sugar in the blood.
Nursing interventions and rationale. Encourage the use of complementary and alternative therapies such as exercise, guided meditation, massage. The rationale, these activities can help reduce stress, and stress can aggravate memory loss. Refer to physiotherapy and occupational therapy team, or rationale, to provide specialized care for the patient to gain physical and mental support in performing ADLs and mobilizing. Assess the client in setting up a medication box, rationale. A medication box can help remind them to take their medication at prescribed times and refill the box. Have the patient gradually participate in more social activities, rationale. Gradually involving the patient to more social interactions will promote a sense of belongingness and improve self-perception. Discuss activities of daily living with the patient and ensure that he or she gets adequate rest periods or downtime for the patient throughout the day. Activities such as reading books, guided meditation, and listening to relaxing music should be promoted so as to calm the anxious patients, especially on rest period of rest.
Conclusion. The theory of Ida Jean Orlando explains that the nurse's role is to find out and meet the patient's immediate need for help. Orlando's therapy emphasizes nurse-client interaction and considers nurses' perception, thoughts, and feelings. Orlando states that patients are unique. Nurses must understand their uniqueness is the key to nursing care, and as well, patients are unique and individual how they respond. Orlando's nursing theory stresses the reciprocal relationship between the patient and the nurse. Orlando's theory focuses on how to produce improvement in the patient's behavior. Evidence of relieving the patient's distress is seen as positive changes on the patient's observable behaviors. Orlando may have facilitated the development of nurses' logical thinkers. Orlando's theory remains the most effective practice theory that is especially helpful to new nurses as they begin their practice. And here are our references.
Thank you for following us through our presentation. We hope you enjoyed it and that it was informative in learning about Ida Jean Orlando and her nursing process theory.